All right, it's Dr. Brett here, and I have Meredith with me, and she just brought up a couple things that she's been noticing while running, and it's kind of prevented you from running at this point, hasn't it?
Yeah.
So the thing she has the biggest issue with is like hip pain, glute stuff, hip flexor stuff, adductor stuff, sometimes some knees, even up into her lower back. So it's just really affected a lot of her gait right now. So we checked a few different things with her from a pelvic perspective. You have to have normal pelvic movement for the things above it and the things below it to work the way they're supposed to. Like, this is the most important piece of your whole body minus your brain above your neck at that point. So really simple with that, but we got to figure this out. And the things with her we worked on is how do we open up the movement there and how do we get some balance? Because she walks around, one hip gets high through here. So now all of a sudden the gait gets a little bit off and now she's adapted muscles. Her glutes have started turning off, and that's what we're going to work on here now is just how we turn those on. So a couple things I want her to do. One is just a reverse lunge. So I'm going to have her stand here. Yep, just facing me here. Yep, walk this way a little bit. And you're going to basically just take a big step backwards and drop your hip. Yep, and you're going to come back up. Good. Do it the other side now. Very good, and back up. So what I'm looking for with this is when she does that, I don't want to see her hip go out. And that happens because that means the glutes stop firing at that point. I want to see that hip stay within her frame, and she did a really good job with that piece. So that's one exercise she can work on, just a reverse lunge, very controlled reverse lunge. Now I'm going to have you lay on your back here for me. Yep. And you're going to bend your knees up just like that and come out just a little bit further, and those are going to be about hip distance apart. There's a little bit of space between her knees. All she's going to do from here is just pick her hips up off the ground so that her pelvis is level with her knees. Go ahead and come up, hold that for a second, back down, good. And do it again, hold it, good. Now stick one leg straight out without moving, there you go. Back down, other side, come back up, good. So the main thing we're working on with this is when she goes, you can relax now. When she comes up, we just don't want to see her pelvis tip on there. We want to see that pelvis stay level when she takes one foot off the ground because it means her glutes are working together on there. That's an easy thing to do. The third thing I'm going to do is have you stand back up here. We're going to face the camera over here. And this is just a RDL, remaining deadlift with balance. We're just going to really work on keeping the foot planted. We're going to go down towards the floor and then back up without letting your hip come back out. Good? It's not easy, is it? No. Do it one more time. Okay. Good. And when you come up, you want to think of like you're basically pulling, as you come down, you're coming up by pulling your hip through. It's not a back exercise, but a hip exercise. It's not a hamstring exercise. That's why keeping a little bit of bent knee helps. All we're doing here, though, is again, by utilizing balance and isolating that one side with the glute, we're forcing that glute to have to do the right thing. Many times people, rather than using the glute as a stabilizer, they turn it off. Now all of a sudden we get hip flexor dominant. A lot of people have tight hip flexors. We get really dominant with our hamstrings. You hear people like all the time, my hamstrings are tight, my hamstrings are tight. Their hip hurts because the glute doesn't keep it in and they're constantly doing this, running and walking and things like that. So that happens as well too. And then we get really tight in lower back. Those all sound like really common things that we all see a lot. Same thing with knee problems because now all of a sudden glute doesn't support here. So the knee goes boom, boom, every time you take a step on there. So all these things happen. We just have to focus on getting the glutes back to where they need to be and getting your pelvis back to mobility where it needs to be as well too.